you have to go back and tell them why. They need to know why. And they deserve to know why. If they took the time to tell you that, hey, I think you can do it better, well, you deserve the time for me to come back and say, this is why we couldn't do it that way, right? So I think that communication piece is vitally important, especially for millennials and Generation Z. Questioning's a lot more prevalent now. People are much more willing to ask questions when they don't understand something, which is good, right? So I think it's really a generational impact when you sit back and you look at the whole picture. Them feeling more comfortable asking questions, they want to see change. And if you don't make the change, they're going to know you didn't make the change. And it's a two-way street, right? They come to you with feedback. You need to be willing to go back to them and give them the yes, no, or why we can't do it. Or, hey, what about if we do it this way? At least having that conversation. Maybe you can't do it exactly how they're asking you to do it, but you find a way to get there and show that you're working with them. I think it goes a long way. If you don't get back to them at all, then why would they give you feedback in the future?
All right, guys, welcome back to a brand new episode of the HR Heroes podcast. I'm excited because I've got Mark Brown with me here today, and we're going to be talking about his HR Heroes journey, the things that he's doing at Oswego Health to be able to kind of support his team and everybody else in his community. Mark, thank you so much for being here, man. I really appreciate it.
Yeah, I'm looking forward to this. I'm really excited as well.
So Mark, as we get started here, I like to ask a humanistic question to kind of get us started, to get a better understanding of how you're currently doing today. So Mark, how's your heart doing today, my friend?
It's good. It's good. I think I feel beaten a little bit, but nerves, right?
I mean, it's all a part of the process, if you will. And so, one of the things that we really love to be able to do is kind of tie today's episode with our last episode. And so I had an HR leader from NBC Universal, Christine, on the last show, and she wanted to ask you a question. She said, in the world of HR, we spend a ton of time pouring into and supporting others. How do you recharge and invest into yourself?
Yeah, that's a great question. I would say that exercise is extremely important to me, and I'm a cyclist. I do long miles. I'm finding as I get older and get further into my career, I want more and more miles. I think what that is just the idea that I can get out there, clear my head, refocus. It just gives me that opportunity. I mean, I did 50 miles on Sunday, and it's just that time by yourself. Your head's by yourself. You get to clear things out. I not only do you get the physical workout, but I think it's a really great mental workout as well.
Let's talk about that a little bit, because I'm always so intrigued by people who love to just get out in that individualistic type of, I would say, exercise like cycling. How did you kind of start cycling in the first place? Where'd that love come from? Because 50 miles is no joke.
Yeah. I'm going to go back a few years here. Back when I was getting married, I started going to the gym. I started doing spin classes, and this is a long time ago. But I also enjoyed watching the Tour de France. I was a big Lance Armstrong fan at the time. Really strange that I hadn't gotten outside on the road. But then we moved away from a gym, and we had 2 kids. And as we had those 2 kids, I gained a lot of weight back. And I said, I got to do something. I'm not close to a gym. And I decided to look for a used bike. And I said, I'm just going to start outside, do what I can. I remember the first couple rides I took. I still remember them to this day. Several bikes ago, but we won't go there. And I remember 5-mile rides. And there was one hill going back to my house that, now I could go up it no problem. But then I had to actually get off my bike and walk my bike up the hill. And since then, obviously your health fluctuates over time, but I think I've maintained my health pretty well, and started doing longer rides. I raced for a while. That was fun for a while, but I started to feel a little bit more mortal, and really didn't want to crash. I crashed a couple times in races. That's not fun at high speeds. So just really now I've kind of taken a step back to say, I just want to get out there, ride, clear my head, work out any frustration challenges I have. And it's a good place to do it.
I love that. I was when I was talking to Christine on our last episode, she actually does a lot of triathlon work and she does long distance swimming in the ocean. And she talked about how just being out and kind of being by herself is kind of that meditative space. And I
Yep.
thought that was so cool. And it's just so cool to hear how we're all kind of, I would say, reinvesting and charging ourselves in different ways. Sometimes, it's going to the gym for me and being around other people. I haven't gotten into that kind of that chapter of my life where I like running or hopping on the bike, but I'm sure that time will come. So really cool to kind of hear, how you picked up that passion and how you're still sticking with it. That's awesome.
Yeah.
So Mark, one of the things that I want to talk about kind of as your role of VP of Human Resources and Chief People Officer, often we think about business today as an ever changing landscape. Specifically, people are more important than ever, and the leaders who lead them are getting more praise. And that's one of the reasons why we do this podcast. But I know that often we don't have the luxury of saying, I'm going to be a people leader when I'm early in my career or at a young age. But I know you had a pivotal experience with one of your friend's dads who was an HR leader who kind of illuminated the path of HR for you very early. And you kind of knew that this was something you wanted to go into.
Yeah, I consider myself lucky because I went through college with a lot of people that I saw switch majors time and time again, including my wife. She switched majors a few times during college. Um, People don't really at that age really don't know what they want to do, right? It's really tough to pick. Oh, this is what I want to be for the rest of my life. But I had a very influential person in my life, like you said, my friend's dad, who took us fishing on a pretty regular basis, and I always admired him and what he did, and I really just learned from him what HR entailed and what that looks like. He said psychology, business, kind of explained how it all works, and me liking, in high school at the time, liking psychology and business both. I was lucky enough to be able to take some of those courses in high school. I said, this sounds exactly like what I want to do. On top of the people side of it, obviously being outgoing. So I consider myself very lucky in choosing that path. But interestingly enough, as I went through college, I could not wait to get to my HR coursework, some of the psychology classes, some of the business classes, and I really excelled in those areas and really enjoyed it.
What were some of those early experiences like for you? Because often we say, I'm going to go down this path, but we don't really have, I would say, those verifying experiences that show us that we're on the right path. Do you remember taking some of those early HR courses where you were like, this is definitely for me? Were you kind of like reinvigorated or just confirmed, if you will, kind of in those early days of school?
Yeah, I would say that my interest, when I took those classes, I was focused. I was interested. I paid attention, right? And sometimes it's not really about what's pulling in your interest, but maybe those classes that I would take, and I'm like, oh my goodness, I don't know if I could sit through another hour of this, right? Those classes that reaffirm that this is not for me, and then go to an HR class and you're like, this is awesome, this is great, and you get excited about it. So it was really, I think, a combination of both, having to take those gen eds that I still don't know why I had to take them. Um, but but yeah, I think it's a little bit of both. And when I talk about our students that we work with, and I always make that a point that it's just as important to learn what you don't like as what you do like, right? And I think that's something that everybody should think about as they go through their career.
Yeah, man, let's kind of talk about that because one of the things that I was super inspired by was your kind of, I would say, strategic alignment with how you start getting in front of the new generation of people who are going to come into healthcare. And we talked about in our previous conversation, I think one of the biggest issues that we have in kind of filling the pipeline of people who are coming into the healthcare space is they don't know how many opportunities they actually have in the healthcare space other than being a nurse or a doctor. And so I want to kind of have you spend a little bit of time talking about the strategic nature of you getting in front of educating and giving experiences to the new generation of people who are coming into healthcare and what that can really mean for the long-term strategy of retention, but also building a buzz around what healthcare can mean in the community.
Yeah, one of the programs that we partner with is the Early College Health Sciences program, right here in our own community. It's with three different high schools that we work with, and then also the community college, who has some healthcare programs after high school. So what we do is we bring these students in. We start recruiting them in the eighth grade, in eighth grade, And those kids that go into the program between ninth and 10th, they start taking college level classes right away, all healthcare prereqs. But the important part is they get to shadow here between ninth and 10th grade. We're also going to bring them in starting this year between 10th and 11th grade. And then between 11th and 12th, we partner with another health system in the area, and they go there for a longer, more enriched experience into whatever area they really have honed in on. So what we help them do is really identify, like I said before, about it's so important to know what you want to do and what you don't want to do in your career. This helps them identify that, hey, this maybe I thought this is for me. This isn't for me. But I really like this. I really like the OR, but I thought I was going to like helping babies be born, but you know what? That wasn't where I want to be. I want to be in the OR, or I want to be behind a microscope, so they really get that impression pretty early on of those interests and what might not interest them. And going all the way up through, they'll graduate between 30 and 40 credits, college level credits, that they'll be able to transfer then into a college of their choice. I will say um, we have 24 students graduating this year from high school. It's the first cohort. So it's the first group we started with. And we have one student who's graduating with 50 college level credits, and all 50 are transferring into her program for a school, for a college. So, and it didn't cost her a penny. It's basically free college level credits. It's going to shave off at least a year and a half of her program. That's pretty cool.
I
That's
mean, that's insane.
Yeah.
Thinking about putting people in a position to win, one of the biggest things that I always talk about is when we are 17, 18 years old, we're asked to make one of the biggest decisions in our lives, as in pick a career. You're going to go down this path in higher ed for the next 4 years. And then once you get out into the real space, you're going to start experiencing that. And it seems like you guys have kind of reverse engineered that entire process to give people a taste of what they can experience in working in healthcare, but also putting them in a position to win by allowing them to kind of accumulate those college level credits. I mean, from a strategic perspective, what an amazing way to get in front of the next generation. When you guys started developing this program, was there any type of pushback? Because naturally, when I heard you say we're engaging and starting to recruit eighth graders, I was like, wow, that seems really early. But if these people find what they love, you're putting them in a position to have a longer runway to take off, if that makes sense.
Yeah, and everybody in management here, and I would say every health system knows how important it is to build talent and develop talent. Some more than others, but I think this from our perspective, the sell was pretty easy because it doesn't cost us anything. It is grant funded, so that was an easy hurdle to overcome. Right? What's this going to cost? Well, it's just time, and we need to make sure we have the pieces in place and the resources to make sure when these students come through that somebody's with them at all times. So we work through various challenges. Buy-in at the leadership level is extremely important. That was extremely helpful. And I will say too, when you look at the program itself, buy-in from all the different partners, right? Not just us. The high school had full buy-in. The former program coordinator for this program is now the principal of one of the high schools.
Oh, wow.
He helped start this program, right? So there's buy-in there. And then you have the community college and you have their leader there that's involved. And all three of us leaders are in the room when we're making these decisions. And if there's a hurdle, we can talk about it and we can find a way to overcome it. So having those engaged leaders is extremely important, both at the partner level and at the facility level.
Yeah, let's talk about that idea of collaboration, because it seems like today a lot of initiatives fail because it's almost like they're created in a vacuum, if that makes sense. Like one person has initiatives, one person has outcomes they want to accomplish, but they don't get buy-in from other areas of the departments or other areas of their collaborating partners. So have you ever been a part of initiatives where you've tried to start where maybe you guys didn't have that collaborative nature and buy-in from all the leaders that you guys are trying to get to buy into a program?
Have I ever been in a situation? Yeah, I'm trying to think of an example um, of a specific project that I've worked on where there wasn't buy-in. I mean, I will say I'll think about it a little bit here, but what I would say is that it's critically important that um, that you're able to get in front of the right people and the stakeholders. And if you get in front of the stakeholders and you show them the return on that investment and what that means. And I said it all the time with this program. Yes, I know it's 5 years and we need nurses today, right? We need nurses right now. We're in a pandemic. What are we doing right now? So you almost have to have a two-pronged approach. You have to have a long-term approach and the short-term approach. But my argument was, yes, we're doing everything we can short-term, but if we don't do something long-term, we're going to be sitting here in 5 years saying, well, why didn't we do something 5 years ago to help build this? Guess what? We're 5 years later since we started this program. So now in 2 years, we're going to have several students come out and work healthcare. We have five that want to be RNs and that want to take advantage of our tuition program. So it's really about getting those stakeholders engaged. And I think that's the critical piece. I can't think of a specific example where we weren't able to get that buy-in. I'm pretty persuasive.
Yeah. Well, the way in which I kind of think about that example was, especially during the pandemic, one of the things that we talked about in our previous conversation was some of the challenges that travel nurses created in some of our organizations. Pandemic happens. We've got nurses who are coming from all over different parts of the country, dropping into different organizations and often leaving at the same rate because they have new opportunities.
Yeah.
That creates that short-term need for, we need nurses today. But if we're thinking about today, we're not going to be prepared for tomorrow. And so it's really cool to kind of hear how you guys were strategic enough to kind of starting plant seeds 5 years ago that turned into now the cohort of students who you have coming into the program. Because now it seems like you guys almost future proofed, if you will, the pipeline. So you're not going to find yourself in that position again. Does that make sense?
Yeah, absolutely. I would agree 100%. And on the short term side, even with the travelers, a goal of ours was to, make those travelers want to stay here. The ones we wanted to stay, right? That's important too. You don't want to keep the ones that you don't want to keep for
Yeah,
lack
let's spend a little bit of time kind of talking about the traveler problem, if you will. For everybody who's listening and watching today who wasn't in healthcare, why don't you give me like a 20,000 foot view of pandemic occurs, we've got travel nurses, what does that mean to the organization? What gaps were they filling? And then you also talked about you want them, the right people to stay. So what does that mean?
Yeah, sure. So from a traveler perspective, when the pandemic hit, you had, obviously patients, volume of patients increasing in very specific areas. I remember specifically Washington State, Seattle, and then you had New York City. Those were like the two that I recall really hearing about. I remember they brought ships of mercy into the port of New York to take care of patients. So there was such a huge increase in volume of patients that those New York City hospitals, health systems, and those Seattle, Washington health systems and hospitals really needed nurses, and they were willing to pay no matter what because they needed to take care of them, right? So that started this market, free market, right? That just started to raise these rates because nurses weren't going. They're not going to go to Seattle, Washington unless you really entice them, right? So they're saying, well, what about 60 an hour? What about 80 an hour? What about 100 an hour? And those numbers just kept continuing to climb all the way up until at one point I remember paying $195 for an ED nurse.
Wow.
So, you do that math, and hospitals and health systems can't sustain that. But as that continued, and as the virus continued to spread throughout the country, that need just kept continuing to increase, and that's why it got to where it got to almost $200. And I'm sure they were paying $200 in some places. But as that continued to happen, um, it just continued to strain the different organizations, both financially and from a healthcare perspective. Um, what I would say is that, how do I say it? Nurses were doing very well, which great for them, right? Again, very challenging for the staff that were here dealing with it. Then on top of that, um, you add in the mandates that were put in place in various states. Not every state had a mandate, but then we had a vaccine mandate on top of that. So now you have people leaving to go travel, meaning that we have to try to find staff, bring more travelers, and then we had this mandate Not disagreeing with the mandate or anything like that. It is what it is. And we had people leave because of the vaccine mandate. They did not want to be vaccinated for whatever personal reason they had. So that created another vacuum for us. And that was not just nursing, it was medical imaging. Those rates were increasing just as drastically as nurse rates. So just really continued to make it challenging. And there was no one to replace them unless you went out and got a traveler. They just didn't exist. Again, we were already in a shortage before the pandemic hit. So,
Very important to recognize. Very true.
yeah, we were already there and we were already thinking creatively on how we make these talent pipelines before the pandemic ever hit. Thank goodness we started 5 years ago before the pandemic, right? Because now we're in a much better position than a lot of our competitors are. What was your second question?
The right fit. So I love this because one of my previous conversations, I had another guy on from Appalachian Regional Health in the Appalachian area, Eastern Kentucky, and he was talking about just because we had travel nurses coming in, they were filling spots. We recognized that a lot of them weren't the right fit for the organization and our culture. So how did you decide what the right fit was, and what did that mean to you guys?
Yeah, to me, right fit is somebody who comes to work, they're happy to be here, they enjoy what they do, right? And you can see that pretty quick. I've been doing this for quite a while, and I can pick up on whether someone enjoys their job or not, the way they talk about it, the passion that they show. So that's really the fit we're looking for. We want somebody who wants to take care of patients, and that's their passion. So we see that. And we see that when they come in as travelers, we get good feedback from patients on travelers. We are doing everything we can to engage with them and get them to stay on as permanent employees. Does it always work? No, no. Because some of them, they like that traveler lifestyle. They like moving from state to state and seeing the country. And I get it. That's if I were 22 and was a nurse, I probably would have been doing the same thing. Yeah, sure, I'll go to San Diego for 6 months and be paid significantly higher than anywhere else, right? So I get it. But if we could just get that carrot in there, and it was the managers. I give all the credit to the managers. If they identified it, they were all over it. They would talk to these travelers on a regular basis. Have you thought about staying here? What do you like? What don't you like? What can we do differently? So getting that feedback from them shows that we want to do this with you. We want to be successful with you. And I think that's really the important piece.
I mean, that feedback loop, I feel like, is a really interesting opportunity that I haven't really thought of before. We've got outsiders coming into the organization. They're leveraging their expertise. We're paying them above market dollar, but we can use them as an opportunity to gather feedback about what do you like here? What can we improve on? And almost using that as a really cool, I would say, instantaneous feedback loop to help retention, and then just trying to change some things as well to kind of help, I would say, attract and keep that talent is really awesome.
Yeah, and we regularly got feedback, even the travelers that didn't stay, on how great they're like, I've traveled all over. This is a great place to work. So, even finding those, that actually was helpful to us. And you hear a lot of feedback from my colleagues in other health systems, and they're very much like, yeah, the employees are really frustrated with the travelers that we're bringing in and how much money they're making, um, and yes, you're going to get some of those employees, but at the same time, if it is somebody who really is passionate about what they're doing, and they come in and they say how great it is to work here, and they're telling your employees how great it is to work here, you can't buy that, right? I mean, it's just it really helps.
I mean, the reputation in itself
Yep.
is almost the biggest compounding factor. And it seems like you guys have been building strategic blocks in the reputation of your guys' organization, not only for people who have been in the space for a long time, but also the travelers and the incoming talent that's coming from the younger generation too. I know one of the things that I really want to give you the opportunity to talk about is one of the differentiators that you have when it comes to culture is you said everybody, first of all, makes eye contact and smiles throughout your entire organization. But number two is that you and your CEO do something special on the first day of orientation. So what does that look like?
Yeah, sure. We sit down at lunchtime and really greet the employees, welcome them to the organization. I look at it as a time for us to really set unwritten expectations. I mean, we don't require you to make eye contact and say hello. to every person that comes through our door or every person you see in the hallway. Um, but just setting that expectation right from the get go. And I talk about it when I say, when I came here as a recruit, as a candidate, when I was recruited here, what really brought me here were the people. And walking through our facilities, any facility you go to, you will get that. You're going to get the, you know, 20 feet down the hall, they're giving you eye contact, smile, and then you get about 10 feet, and it's, how's your day going? Did you have a good night? Or have a great night, have a great afternoon, good morning, right? So, and it's warm, it's genuine, and I tell these new hires this story, right? And what that does is then sets the tone. It's kind of interesting because we just had a 90-day follow up. So after we meet, the CEO and I meet with these new hires each week. About 90 days later, we sit down with them again and have a lunch. And it's voluntary, but we get that feedback. How's your first 90 days? What can we do differently? How was your onboarding experience? Did you have trouble training? Did you have trouble getting on a particular system, right? We ask these questions and we get the feedback, and guess what we do? We make adjustments where we need. Like I got one, which is the first time I heard, for whatever reason, they thought the benefits could be a little bit more detailed, the benefit conversation. So we are making that change immediately for the next group, right? We make that change and we do that. And so this 90-day group, they give us great feedback, but it was great because resoundingly around the room, and there were about a dozen people in the room, and they talked about how everybody says hi, it's warm, it's a great place to work, right? It was almost like, and I wasn't doing any Jedi mind tricks, right? It was almost like they were repeating me, which makes me feel proud that, wow, this is what we're building, right? We're building this, and these employees are feeling it. Like, that's a great thing. And guess what? That's only going to increase engagement, reduce retention, or reduce turnover, increase retention, right? It's going to do all the right things that we need to do to stabilize the workforce. So
How big of a role do you feel like communication has been in this process? Because what I'm hearing you talk about is you have open doors of communication. You've got open policies of nonverbal communication as well, which kind of is like your superpower. And especially when your team is communicating back the things that you mentioned to them, it's got to feel amazing to kind of see how like the secret Jedi mind tricks, if you will, are like really having an impact on the organization, the team's culture.
yeah, it really is. And I would say, and I'm not in a virtual environment, right? Well, this is not remote. We are in front of each other pretty regularly. We are patient facing, right? And so far, they haven't figured out a way to make it completely remote for patient facing people. We just haven't gotten there yet. Maybe one day. We are going into telehealth and all of those things, but there's still that interaction, and I think that's critically important. And I'm sure remote companies are doing this too, but just getting in front of your people, not just emails, not just text messages or, inter office texting programs. It really is talking to somebody face to face. I think is critically important. And not just the formal conversations. I think a lot of times the casual conversations are where some of these things happen, right? Where the ideas come from, good ideas, way we can make improvements. So we tell employees, on their first day, hey, if you see us in the hallway and you have a suggestion, don't hesitate to stop me. I don't care where I'm going. I don't care if I'm late to a meeting. If you have a good suggestion and you think I would like to know or should know, stop me in the hallway. Don't hesitate. And if you have a question, don't hesitate to ask that question. We pride ourselves on being, as leadership, on being approachable. And I think that's so important, that casual interaction that a lot of companies I don't think have, and probably need to be a little more thoughtful about how they spend time doing that.
There's almost a popularity, if you will, and I'm just going to kind of articulate this out as I'm seeing in my head. There's a popularity that's coming around with like kind of flat level organizational hierarchy, if you will. And one of my favorite conversations about this topic was Tesla, as an example. There was an engineer who was on the floor and he was doing something with the battery packs of their Model 3. And he recognized that if they changed one small thing, they could get better charging rates to the battery, meaning we can get an extra 15% battery charge in about 20 minutes. What did he do? He went and took it to his manager, and within 3 hours, they had changed the configuration of the assembly line to implement this guy's new suggestion. And when I think about some of the examples that you see out there in the world of business, having a flat style organization where people feel like leadership is approachable is becoming so much more prominent because it produces results. And I feel like we've gotten away in the history of business away from, or we're trying to get away from, that hierarchical structure of, you don't talk to me as the CEO, I'm the leader of people and culture, I'm somebody who has a gatekeeper. Why do you feel like that is kind of getting away from, or we're trying to push away from that in business? I know you touched on it a little bit, but why is it so important, especially in today's world of business culture?
Well, I think you're talking about a big generational change, right? Things are done much differently now with the new generations, two generations now coming in, younger than me, younger than my generation. You know, many of the baby boomer generation are retiring. They looked at things much differently. Your manager told you to do something, you did it, right? Questioning's a lot more prevalent now. People are much more willing to ask questions when they don't understand something, which is good, right? Um, so I think it's really a generational impact when you sit back and you look at the whole picture. Them feeling more comfortable asking questions, generation the millennials, right, or even Z, and they're going to ask all day long, and they want to see change. And if you don't make the change, they're going to know you didn't make the change, and they're not going to stick around. They want people that are going to take their ideas and run with them. You can't run with every idea, and in those situations, right, you have to go back and tell them why. They need to know why, and they deserve to know why. If they took the time to tell you that, hey, I think you can do it better, well, you deserve the time for me to come back and say, this is why we couldn't do it that way, right? So I think that communication piece is vitally important, especially for millennials and Generation Z.
Yeah, that feedback loop is incredibly important. I had another individual who was on the podcast. Her name is Rhonda. She's from Ascension Health. And she talked about one of the really cool ways in which they were communicating that feedback loop was a simple strategy. They had a green, yellow, red board in the like nurses' stations where they would communicate ideas that have been brought up to leadership. They'd either be green, as in, we understand this, we heard this, we're making it happen right now. Yellow, we heard this, we saw this, we're not going to be able to implement this now, but we're working on it. And red, we heard this, we saw this is something we can't do right now. And the simple use of those three colors and communicating that stuff on a board was one of the things that she said changed the organizational culture because it improved that feedback loop of communication. Because how frustrating is it, especially if you're in a younger generation, where you bring up an idea to your boss and you say, hey, I think we could do this differently. And then they say, okay. And then it just disappears forever. That's kind of like a turn off experience. You know what I
Yeah,
mean? But that feedback loop
absolutely.
is so important.
Yep, absolutely. That's why that it's a two-way street, right? They come to you with feedback. You need to be willing to go back to them and give them the yes, no, or why we can't do it. Or hey, what about if we do it this way? You know, at least having that conversation. Maybe you can't do it exactly how they're asking you to do it, but you find a way to get there and show that you're working with them. I think it's just it goes a long way. If you don't get back to them at all, then why would they give you feedback in the future?
100% right. So, what do you don't think that the younger generation, because this topic gets thrown out a lot, and I think it's rooted in a sense of judgment. Gen Z and millennials, they're so entitled. Why is that right, or why is that wrong?
Um, that's a good question. Um, I think it's a wrong way to think that they're wrong just because they're different or they're thinking differently, right? And every generation since the dawn of time, I would argue, thinks different than the generation prior to them, right? That's what defines the generation. So I don't think it's necessarily wrong, and I don't think it's necessarily right either. It's just different, and I think in order for us all to be successful, we need to be able to explore it and be honest with ourselves to say, well, maybe I wasn't doing it the right way for the last 15 years, right? Which is a pretty big thing to say. You're doing
Very
something for
scary.
15, 20, 25 years in your career, and to go back and say, you know what, I've been doing that wrong for 15 or 20 years. No one wants to do that, right? So I think you need to be brave in a way in accepting what they're telling you and the feedback they're giving you.
What do we feel like about the future of HR? Now, I know that this wasn't on part of our framework document, but I really want to get your 2 cents on where do you think the space of like AI is going to play in the future of human resources?
Yeah, that's a great question, and I'm on the fence. Like and maybe people are going to criticize me for that, but I see the positives and the negatives, and I see it on LinkedIn. I see job seekers who are searching for jobs, and they're basically applying to AI, and AI sees something they don't like on their resume, and they immediately knock them out without any exploration with that candidate, right? So I see that negative side of it, but I also see the positive side of it where it can reduce those menial tasks, things people are doing that are really manual and on a computer, and probably can their time can probably be spent doing um, more focused things on employees from an HR perspective, specifically on employees being more proactive, getting in front of employees, listening to employees. Those things that this younger generation needs, that interaction. So I think that's also the benefit, right? So look, it's going to continue to evolve. And I think they'll figure out a lot of those bugs as time goes on. Where it immediately discounts somebody because they don't fit all the pieces. Um, you know what it looks like in 5 years, I have no idea. I mean, it's moving so fast. Every day I open my computer and there's something on AI coming out. So it's hard to say where it is in 5 years, and what that looks like. But I think they'll fix things, they'll make things better, and I do think it will make our time better spent.
Yeah, I mean, I think you used the word curiosity, or the word when you were talking about kind of, the scary process of being brave enough to look at things differently based on how I've done it for the last 15 years means curiosity in my head. We have to be able to form a healthy sense of curiosity that means let's look at the scenario and decide how this fits rather than saying this is good or this is bad. Because red or blue is not the answer here. It's more likely kind of a purple, which is a meet in the middle. And I want to continue to kind of push the boundaries of AI. I was watching a clip on the internet the other day of the CEO of Nvidia talking, and he was like, AI is not going to steal your job, but someone who properly knows how to use AI to make themselves more effective is going to take your job. And so we have to be curious enough to say, how does this fit into my space? Because like you said, technology in itself is improving exponentially and it's not going anywhere soon. But we need to be curious enough to say, how does this fit? But at the same time, we cannot take away the human element because I do speak to a lot of talent acquisition leaders who talk about AI is scary from an acquisition perspective because we're losing the human element. I don't want a decision algorithm tossing people out of the hopper even before they get there, although they might have a ton of lived experience, which I feel like we're all really rich in since the pandemic and everything else.
Yeah, I agree with you 100%. You can't be blind to it and ignore it. And at the same time, look, I'm not naive to say that it's not gonna take away some people's jobs. Some companies are gonna take advantage of that. I look at it from a perspective, at least where I'm leading and where I am, that I'm gonna use it as a way to improve the work experience for my employees and have them do things that are going to benefit the organization, benefit them as well, and not sit and do the same thing every day that could be done by something else, right? That's where my head goes. And I've seen that before, even with bots. When you're talking about bots, and you put bots into your system, and maybe it's electronic filing, right? And it knows that if it has this at the top, it goes in this filing, right? And we implemented that at my prior organization quite a bit, and it saved one person. It saved 20 hours of their week.
Wow.
I didn't lose a half a person. I changed their focus and started having them do other things that were more beneficial for the organization. So I think it really is going to take people with that mindset, that curious mindset. How can we make things different and better as you implement these things?
I mean, because a huge part of, I want to say burnout as an example is when we start losing sight of the agency that we have to impact our environment. Imagine you showing up to work every single day and doing the same medial, redundant, repetitive tasks over and over again. It's like, dude, this isn't my human calling. I don't want to be a part of an organization where I'm literally just like putting things in one file and moving them over. That doesn't seem like a very enriching life. And so if we can use technology to accelerate those people, to put them in positions of leverage, I feel like that's a home run, but we need to figure out what that really looks like. And very transparently, the classic HR avatar in itself is not somebody who really thinks outside the box too often. The adoption rate of things like AI is not something that we see coming from that space. It's normally from your tech startup or your founder or somebody who's got a big vision. And so helping that new generation of HR leaders kind of think about that sense of curiosity, I feel like is a real opportunity. And I'm glad that you've kind of touched on that a couple times today because it's super important.
Yeah, I would agree 100%.
So, what do we feel like the future of HR is going to look like specifically in healthcare? We just came out of, a gauntlet by fire, if you will. We've had to change things up. We've had to really kind of start thinking about future proofing our pipeline, like we talked about, how we can hone a sense of curiosity, which I really love kind of emphasizing. So, what is the next couple of years from your perspective in healthcare really going to look like if we're going to be able to continue to climb out of the situation we're in now?
Yeah, it's all about education and training the next workforce. In my opinion, people are going to leave, they're going to retire. All of those things are going to happen, right? And we know that, and we knew it 20 years ago. I think this was an eye opener. People weren't expecting it. People thought they had 10 more years, 15 more years. I think it woke everybody up to say we better start doing things now and fixing this now. Like I said, I feel that we're very lucky that we took that strategic approach before the pandemic hit because we got a head start. And now people are reaching out to me and saying, "Hey, I want to learn about your program." Right? I'm talking about this early college health sciences program. Tell me about your enhanced tuition program where you're paying for people to go to nursing school. What's that look like? Well, how do you guarantee that they're going to come work for you? Right? Those questions that they never really thought about or had to answer, they're coming to me for those questions. So I think I'm already seeing it, that increase in education and the importance we're putting on it to build people in our own, build this talent right in our own community. That's critical. That's where we're going. I'm seeing it everywhere. That the state is putting a lot more money towards education. At least in New York State, I know other states are doing it too. You're starting to see healthcare high schools open up across the country, philanthropically backed. Bloomberg has done a few in various areas of the country. So it really is building that talent and getting kids interested earlier is where we're seeing it go. And my head tells me in 10 years, future of HR from a talent perspective, in healthcare, we're going to be much more stabilized. We're going to be looking at things from this perspective and just continue to improve these pipelines and how we're building talent. That's my thought.
I mean, it seems like it's really the only sustainable way to get out of this, right? Because we've talked about kind of the challenges that we're faced from a pipeline perspective. And unless we get in front of this next generation early and often and give them a true taste of what it can mean to be in healthcare administration, facilities, environmental services, in the OR, being able to
Yep.
be a nurse, being a doctor, there are so many ways in which we can kind of, appetite this new generation to kind of get in here, which is really cool. And I'm so glad that Oswego Health is using, the strategic nature of educating the next generation, because you guys are going to find yourselves in a place of sustainability that a lot of people are going to be scrambling for. And I'm sure those phone calls are going to be coming to Mark a lot more often and
Yeah.
saying, "Hey, how'd you guys do this back in the day?"
Yeah. And just as important is once they're here, right? Once these students are here, is making sure that you're doing all the right things to keep them here. And that includes letting them continue to learn and making it easy for them to find that career pathway. If they can find that career pathway and it's easy and they can picture it in their minds, and this is how I'm going to get from X, Y to Z, right? That's huge for them. You're making it easy for them. That's what you need to do. And I think you'll see that continue to happen and develop.
Well, man, I can't thank you enough for coming on the show. I want to use the last couple seconds here as an opportunity for you to pose a question for our next guest. What do you got for us, Mark?
That's a good question. I wish I knew who your next guest was. Um, I would say, let me think of a good one here. And maybe I'll sort of link it up with mine, right? I've really had a big focus on talent development. What are you doing as an organization to um, build the next generation of talent?
I love that. That's a great question. And it really kind of gives us kind of an opportunity to kind of really, I would say, pragmatically and tactfully think about the future. Because, like we said, the value of building the next generation is irreplaceable. And when you do it with intention and you do it early, then we're not going to find ourselves in the same type of challenges that we're facing now. So, Mark, I just want to say, man, thank you so much for coming on the podcast. You are the true definition of an HR hero. Because of the things that you're doing to inspire the next generation, but also take care of the people who are in the space now. And I just want to say for everybody watching and listening, man, thank you so much for coming on the show.
Thank you. I really appreciate it. I had a good time.
All right. There you go, guys. That's another wrap of the HR Heroes podcast. Once again, Mark Brown, thanks so much. Appreciate it.